change his mind on vaccine safety. Nevertheless, it sure looks like my Republican colleagues have bowed to pressure from Donald Trump and are poised to hand Mr. Kennedy the platform he has been seeking for 2 decades to push fringe views. So before the Senate votes, I'd like to take a moment to talk a little bit about the fights ahead on health care. Republicans in the House are already pressing ahead this morning with their plan to kick millions of Americans off of their health insurance in order to fund more tax cuts for those who are very wealthy. And as HHS Secretary, Mr. Kennedy is going to be a key player in this effort. While senators were on the floor speaking yesterday, the Senate Budget Committee debated a budget resolution that unlocks the legislative tools Republicans need to make good on their go-it-alone plan. At the same time, the House Budget Committee released its own budget resolution that will be debated today. Mr. President, what is clear in both of these blueprints, in their game plan, is that Medicaid cuts are at the top of the list. 81 million Americans rely on health care coverage under Medicaid and the CHIP program for kids. Those people are folks with disabilities, low-income families, seniors, and of course, children. The damage and destruction to American families if Republicans go through with their plans to gut Medicaid cannot be overstated. Take nursing homes, for example. 2 out of 3 nursing home residents are currently being covered for their health care by Medicaid. Imagine you visit your mom in her nursing home in the months after the Republican bill makes steep cuts to Medicaid. Your mom complains there are fewer and fewer staff. She had to wait more than an hour after calling for help to use the bathroom on several occasions. Next time you visit, she tells you some of the new staff don't have time for her. You learn that the facility no longer has the resources to conduct background checks and that they're desperate for workers. A few weeks later, the facility manager pulls you aside to deliver some bad news. Her nursing home can no longer accept patients with Medicaid after steep federal cuts to the program. Unless you can find another facility that accepts Medicaid, you've got to pay the high monthly costs out of your own pocket. Suddenly, and with no warning, you've got impossible options. Either you scramble to find the money to cover a new facility that costs thousands of dollars a month, or you bring your mom home with you. So between holding down a full-time job and raising young kids, suddenly you have to deal with making sure that your mom gets full-time care, and that requires around the clock. Unfortunately, this case I described is something you see in every nook and cranny of America. I know that from my days as co-director of the Gray Panthers. And I know that many of your friends and neighbors with aging parents and grandparents in nursing homes are facing the catastrophe that I've just described. Now, Republicans are going to do somersaults to disguise their cuts to Medicaid, and they're going to describe it in healthcare lingo that they think plays well with people. For Republicans, every single child, senior, or family struggling to pay the bills that gets denied coverage is a win. And that brings us to Mr. Kennedy. During his confirmation hearing on everything from abortion to vaccines to Medicare and Medicaid, Mr. Kennedy was given ample opportunity to go on the record about how he would improve these programs, bring down costs, save taxpayers money, and improve care. Instead, he showed a complete lack of understanding of the basics of Medicaid and how it functions. I personally believe it shouldn't be too much to ask for the future CEO of Medicaid to understand how important it is to provide affordable coverage for millions of families. Republicans, with Donald Trump at the helm, are steering our country toward a health care cliff. Their ultimate objective is to take away Medicaid from as many people as they can. Colleagues, so much for making America healthy again. What the American people need is a leader who will be the voice of reason in the room as Trump and his assistants in Congress start slicing and cutting. Our country needs a leader at Health and Human Services who's actually going to work to improve care and lower costs, defend the reproductive freedoms of families, and listen in particular to facts and science. The American people have no reason to believe, based on the record, the evidence that the Senate Finance Committee has accumulated, to believe Mr. Kennedy will be that leader. There is no question the healthcare system in America needs reforms. It's falling short, and Democrats want to work in a bipartisan way on those issues. We are disillusioned by a system that puts profits over patients in too many circumstances. Nobody on this side of the aisle is arguing for the status quo. But the solution, colleagues, and I'm closing with this, does not lie in Donald Trump's, quote, concept of a plan to make our country less healthy, less safe, and less successful. When kids are kicked off their Medicaid coverage and forced to go without basic medical care and grow up with chronic illnesses that leave them in a lifetime of pain and suffering, Republicans are going to regret any vote they give to Robert Kennedy. When seniors are told they have to vacate their nursing homes because it no longer accepts Medicaid, Republicans again will regret a vote for Robert Kennedy. When families are struggling to pay the bills and they're landed with a mountain of medical debt because their kid got sick and they were kicked off their insurance, finally, Republicans will regret any decision they give, any vote they give to Robert Kennedy. Mr. Kennedy will no doubt be right alongside Republicans, a willing participant in this future for healthcare that I've described today, that is really stepping back from progress that has been made. I urge a no vote, colleagues, and I yield the floor.
Mr. President.
Senator from Idaho.
Thank you, Mr. President. I rise today in support of Robert F. Kennedy Jr.'s nomination to be Secretary of the U.S. Department of Health and Human Services, and to urge my colleagues to vote in favor of his confirmation. Contrary to the attacks that have constantly been made on him, he has made it very clear that he will support safe vaccinations and just wants to see that the research on them is done and done well. When his nomination for the role of Secretary of HHS was announced, Mr. Kennedy stated, "We have a generational opportunity to bring together the greatest minds in science, medicine, industry, and government to put an end to the chronic disease epidemic facing Americans." I agree with him. We've got to get into the business of making America healthy again. Mr. Kennedy's dedication to this commitment has been apparent throughout the nomination process. He will bring a fresh perspective to healthcare, prioritizing consumer choice, information transparency, and early interventions to strengthen the well-being of all Americans. He has been responsive to a wide variety of questions from members on both sides of the aisle, appearing before 2 committees and answering hundreds of questions for the record, not to mention going through the extensive vetting process of the Finance Committee, which I chair, which is the most extensive vetting process that any candidate in the Senate goes through for a position in this administration goes through in the Senate. While some of my colleagues continue to question his financial agreements, Mr. Kennedy met and then exceeded the requirements set forth by the Office of Government Ethics. Mr. Kennedy has participated in one of the most extensive processes, as I've said, that our Senate puts a nominee through, and has succeeded in meeting those standards. And I encourage my colleagues to support his nomination. Now, before I close, I want to respond briefly to the comments that we've heard today here on the floor and all day yesterday in a long budget committee hearing to set up the first reconciliation legislation to come before the Congress. It was said today that Republicans are going to take Medicaid away from children. They are going to take health care away from seniors. It was said yesterday that we were going to go after pretty much old people, young people, middle-aged people, and every other kind of people. because we are going to destroy the support base that they have here in the federal system. The fact is, this is the politics of fear, the politics of claiming things that are going to happen, which are not going to happen. The reality is that yesterday's budget committee meeting was not on health care. There was nothing done in the meeting yesterday that would have done any of the things that you've heard on the floor today. What we did do yesterday was to set up a process so we can provide some significant extra spending authority to our government to close the border and deport the violent criminals who have come into our country in the millions in the last few years. We had another provision in it to give significant new resources to our national defense so that we can build back our Department of Defense and the authority of those armed in our armed services, the ability of those of our armed services members to have the technology and the equipment and be capable of responding to threats to our nation. And finally, we restarted and charged up our use and engagement in producing America's energy in America so that we can get back into the business of being independent and not relying on other nations for our energy policy. Those are the three things that we focused on in the committee yesterday. And by the way, each one of those was a little bit costly, and every one of those was offset so that there was no increase in federal spending. Mr. President, I think we need to argue over facts when we get into these debates. We're going to have a tremendous number of debates. And yes, we will debate on healthcare at some point. But yesterday, and what we did yesterday, was focused on the border, on national defense, and on reboosting our energy production in America. I encourage a strong yes vote for Robert F. Kennedy to be the next Secretary of the U.S. Department of Health and Human Services.
Mr. President,
Senator from Oregon.
I would ask unanimous consent for 1 minute for an opportunity to respond to my colleague from Idaho.
Without objection.
Thank you, Mr. President. I would only say to my friend from Idaho that he says this is not going to happen, that people are going to be safe and seniors on Medicaid and the like will be safe. I would just say to my colleague, it starts today in the other body of Congress. I'd say to my colleague, the process of setting in motion these cuts to essential healthcare services begins today. We can read about it in the publications about the congressional schedule. I look forward to working with my colleague when we can find common ground. But on this point that it's not going to happen, everybody's going to be safe, the efforts to cut these vital programs, including Medicaid, begins this morning in the other body, and I yield the floor.
Could I have 30 seconds to just respond? I ask unanimous consent.
Without objection.
Mr. President, I would simply say that we hear this every time we look at trying to address the spending excesses in our government. And I will just say to my colleague and to everyone, we're not going to take health care away from children. We're not going to take health care away from adults, from seniors, or middle-aged people. We are not going to attack the benefits that people get under Medicare. And frankly, we will reform some of the spending, yes, but we will not do all of the terrible things that are being spun up to try to attack this effort to control the excessive spending in our government.
Democrat leader.
Thank you, Mr. President. Mr. President, the fact that we're here right now, that we're even here right now, voting on this wildly unqualified conspiracy theorist to trust with one of the most life or death jobs, HHS secretary, charged with protecting the health of every single American, should be an affront to every senator and the millions of Americans that will be impacted by this horrific nomination. My colleagues on the other side of the aisle, I implore you, think one more time about this vote. My colleagues on the Republican side, you know the consequences of what you're doing. My colleagues on the Republican side, you know how dangerous this is. My colleagues on the other side, you know you are not putting your constituents, their health, their families first when you vote yes. To quote my colleague, the junior senator from Texas, just a few years ago, he said, quote, "We need an expert. We need a scientist. We need someone who knows something about healthcare heading the Health and Human Services Department." Well, which is Robert Kennedy? An expert? A scientist? Or what about the senior senator from Louisiana, the chair of the Health Committee, and a well-respected medical professional himself? A few years ago, here's what he said. Previous HHS secretaries have had a pharmaceutical industry background, have been a state health commissioner, have run health systems, have been governors. Somebody who has had a background in actually administering the programs that HHS administers. I ask my colleagues, which of these qualifications does RFK possess? You know the answer, none of them. The question in front of this body today, the question in front of this body is not simply to confirm RFK to run the nation's health department. The question before us is very simple. Which is more important to you? The health and well-being of your constituents, or blindly obeying orders, knowing full well the dangerous impacts your vote will enable? I plead with you one more time, rethink this issue. This is dangerous. This is wrong, very wrong. I yield the floor.
Under the previous order, all post-cloture time is expired. The question occurs on the Kennedy nomination. Is there a sufficient second? There appears to be. Clerk will call the roll.
Ms. Alsobrooks, Ms. Baldwin, Mr. Banks, Mr. Barrasso, Mr. Bennett, Mrs. Blackburn, Mr. Blumenthal, Ms. Blunt Rochester, Mr. Booker, Mr. Bozeman, Mrs. Britt, Mr. Budd, Ms. Cantwell, Mrs. Capito, Mr. Cassidy, Ms. Collins, Mr. Coons, Mr. Cornyn. Ms. Cortez Masto. Mr. Cotton, Mr. Kramer, Mr. Crapo, Mr. Cruz, Mr. Daines, Ms. Duckworth, Mr. Durbin, Ms. Ernst, Mr. Fetterman, Mrs. Fisher, Mr. Gallego, Mrs. Gillibrand, Mr. Graham, Mr. Grassley, Mr. Haggerty, Ms. Hassan, Mr. Hawley, Mr. Heinrich, Mr. Hickenlooper, Ms. Hirono, Mr. Hoven, Mr. Husted, Mrs. Hyde-Smith, Mr. Johnson, Mr. Justice, Mr. Kane, Mr. Kelly, Mr. Kennedy, Mr. Kim, Mr. King, Ms. Klobuchar, Mr. Langford, Mr. Lee, Mr. Lujan, Ms. Lummis, Mr. Markey, Mr. Marshall, Mr. McConnell, Mr. McCormick, Mr. Merkley, Mrs. Moody, Mr. Moran, Mr. Moreno, Mr. Mullen, Ms. Murkowski, Mr. Murphy, Mrs. Murray, Mr. Ossoff, Mr. Padilla, Mr. Paul, Mr. Peters, Mr. Reed, Mr. Ricketts, Mr. Risch, Ms. Rosen, Mr. Rounds, Mr. Sanders, Mr. Schatz, Mr. Schiff, Mr. Schmidt, Mr. Schumer, Mr. Scott of Florida, Mr. Scott of South Carolina, Mrs. Shaheen, Mr. Sheehy, Ms. Slotkin, Ms. Smith, Mr. Sullivan, Mr. Thune, Mr. Tillis. Thank you. Mr. Tuberville, Mr. Van Hollen, Mr. Warner, Mr. Warnock, Ms. Warren, Mr. Welch, Mr. Whitehouse, Mr. Wicker, Mr. Wyden, Mr. Young, Senators voting in the affirmative: Bozeman, Cornyn, Crapo, Graham, Mullen, Risch, Rounds, and Tuberville. Senators voting in the negative: Bennett, Gallego, Lujan, Markey, Schumer, and Wyden. Mr. Wicker, aye. Mr. Marshall, aye. Mr. Moreno, aye. Mrs. Britt, aye. Mr. Heinrich, no. Mr. Justice, aye. Mr. Sullivan, aye. Mrs. Blackburn, aye. Ms. Baldwin, no. Mr. Murphy? No. Mr. Cotton, aye. Ms. Also Brooks, no. Ms. Warren, no. Mr. Young, aye. Mr. Kelly, no. Mr. Johnson, aye. Ms. Ernst, aye. Mr. Durbin, no. Mr. Cassidy, aye. Mr. Sanders, no. Ms. Hassan, no. Mr. Peters, no. Mr. Barrasso, aye. Mr. Reed, no. Mr. Curtis, aye. Mr. Ricketts, aye. Mr. Thune, aye. Mr. Ossoff, no. Mr. Haggerty, aye. Mr. Van Hollen, no. Ms. Rosen, no. Mr. Banks, aye. Mr. Tillis, aye. Ms. Duckworth, no. Mr. McCormick, aye. Ms. Cortez Masto, no. Mrs. Hyde Smith, aye. Ms. Blunt Rochester, no. Ms. Collins, aye. Mr. Langford, aye. Mr. Sheehy, aye. Mrs. Murray, no. Mr. Hoven, aye. Mr. Scott of South Carolina, aye. Mr. Merkley, no. Mr. Budd, aye. Mrs. Gillibrand, no. Mr. Moran, aye. Mr. Fetterman? No. Mr. Schatz? No. Ms. Smith? No. Mr. Husted, aye. Ms. Lemus? Aye. Mrs. Capito, aye. Ms. Cantwell? No. Mr. Kramer, aye. Mr. Kim? No. Ms. Murkowski, aye. Mr. Coons, no. Mr. Kane, no. Mr. Warner, no. Mr. King, no. Mr. Warnock, no. Mr. McConnell, no. Mr. Schmidt, aye. Mr. Cruz, aye. Mr. Lee, aye. Mrs. Moody, aye. Mr. Daines, aye. Mr. Schiff, no. Mr. Booker, no. Mr. Padilla, no. Mr. Blumenthal, no. Mr. Hawley, aye. Mr. Kennedy, aye. Ms. Hirono? No. Mr. Grassley? Aye. Fisher, aye. Ms. Slotkin? No. Ms. Klobuchar? No. Mr. Whitehouse? No. Mr. Hickenlooper? No. Mr. Scott of Florida, aye. Mr. Welch, no. Mrs. Shaheen, no. Mr. Paul, aye.
On this vote, the yeas are 52, the nays are 48. Confirmation is confirmed. Just number 4? Yeah, but just number 4. Under the previous order, the motion to reconsider is considered made and laid upon the table, and the President will be immediately notified of the Senate's action. Under the previous order, the cloture motion with respect to the Rollins nomination is withdrawn. The clerk will report the Rollins nomination.
Department of Agriculture, Brooke Rollins of Texas to be secretary.
Question occurs on the nomination. Is there a sufficient second?